So actually the pain is necessary for body. So fever, vomiting, nausea and pain, these are required things. But the level, as you said, कि कितना रोए, कितना ये करे.
Yes.
So pain is necessary. But कब तक हो? 2 महीने हो गए, 2 हफ्ते हो गए, बार बार हो रहा है. Then we need to address the origin. So if person is crying repeatedly in unhealthy way, because crying is healthy, we can do as much as time as we want. But if it is happening in healthy way or it is getting closure, so if after crying person is feeling happy, relaxed and able to continue the life in a better way, then it's good. But if it's not stopping and it's getting connected or it is stuck in loop, then every time the child is crying and not ending that venting in a healthy way, then we address those emotions. Then we address the origin of it, कि कहाँ से आ रहा है, क्या चीज़ है जिस वजह से वो stuck वहाँ पे.
Hello everyone, back again to another episode of Talkies and Travels, and here I have somebody new and interesting for you all to hear, and don't skip the video. So here I introduce to you Dr. Swapnil Bhopi. He is a clinical psychologist and he has a lot to share with me, with us. So let's take the opportunity and hello doctor. So kindly introduce yourself to my viewers today.
Yeah. So hello everyone. My name is Swapnil Bhopi. I am clinical psychologist and I practice in Khagar.
Clinical psychology, it itself gives me at least thing to know, curiosity. What is psychology? During our times, we thought we had the term psychologist, we heard the term counselors, but I never thought that students go there in a huge number. It was either we thought how many in a week might be 7 to 10, or in a day there might be 2 or 3. So we wondered that why do doctors take this line? Are they really children, students, patients who you really have to give a counseling, clinical psychologist, this term related, you give so much of study into this, your strength after this. But now the way it has increased, the population, the people coming out to speak openly. And then there are so many therapies. What I hear is teletherapy and all this. So can you talk to us about it a bit?
Yeah. So people usually think that because there is lack of awareness and understanding, so generally people also ask कि आते हैं तुम्हारे पास एक दो लोग तो आते होंगे. So no, we are like highly in demand, I will say.
Yes.
And theoretically there are different fields. So positive psychology, social psychology and all. And field wise, practice field wise, there is counseling psychology, clinical psychology, industrial psychology, forensic psychology, and then geriatric, pediatric and all. So I am a clinical psychologist. I deal with a pathological or clinical aspect of mental health.
Okay.
Means illnesses, disorders, ये हमारे अंडर आते हैं. Whereas a counselor or general psychologist may deal with non-clinical population जिसमें illnesses, disorders नहीं आते हैं. General stress, mild depression या बाकी academic related issues, relationship related issues, which are not falling in clinical part. So in a way we can say कि बीमारियों से related या major conditions related हम handle करते हैं. तो इसमें testing diagnosis का भी role हमारा आता है and then counseling therapy का भी आता है.
It's a big responsibility. Thank you first again. I'll give you my thanks that you have taken the responsibility of reaching out to people, helping out to them. It's a big thing, and not all are trained to do this. Not all at all trained to do this. Though at home we counsel children, we try to send them to wiser people, elderly, grandparents, talk to them. But actually there is something which needs medication. And there is your important role. And now the world is also acknowledging that. So as you just spoke right now, psychology, we have so many thoughts, especially when it is ingrained in our childhood, that we call past traumas. How does it affect you? How do you deal with that?
Okay.
Do patients really come and openly tell in one session how many sessions you have to take? Just tell us about it.
So usually it varies. When we are talking about brief therapies, it is usually 2, 4 or 6 sessions. And when we are talking about general therapies, so it will take 8, 12, 16 or even hundreds of sessions.
Okay.
Sometimes people do come with their concerns without knowing that it is engraved in their childhood. And nowadays, because of awareness, many youngsters or even adults come with this specific identification that this is because of my childhood traumas. So it varies. If there is understanding and insight or even there is acceptance when we disclose it, then it becomes very easy and there are less number of sessions required. But if there is a denial or poor insight, unacceptance is there, then it may take multiple sessions or more sessions.
Yeah. So like examples like, some really understand, as you said, some have seen death in the family of a very close member, some have been abused, some have been said, bad words or something, pressure, comparison, all are there ingrained to them. But they did not come at that time. They did not, never knew about a psychologist visiting that, and they never came during their school days, neither during their college days, but it has been with them. So suppose it is there ingrained in me. I never went to any psychologist, though I need help. Now people in the society environment tell she acts something very odd, don't talk to her, she's something very strange. And how does she behave, why does she behave like this? Parents don't understand, they keep abusing and shouting more rather for my good, but they even don't know how to handle. At one stage now it's saturated, saturation point. I now have my family, I now have my workplace where I am carrying that behavior along with me. What kind of help do people like me should go for?
I will say long-term therapy sessions will be more helpful because if awareness is there, then it will be easy and quick to address those things. But if those are like underneath, so to probe that, to elicit that, and then work on that, it takes time. So I will say any long-term approach, it can be like cognitive behavioral therapy approach, it can be psychodynamic approach, depends on the case. So actually this can be decided after knowing about the case, but generally any long-term therapy sessions will do.
As you said, now cognitive behavior, cognitive or mindfulness, being aware. यहाँ पे इसका क्या role है? How do you guide?
So basically, as a clinical psychologist, we deal with clinical cases, and we have like a major chunk of it. Largely, we work on those principles.
First, tell my viewers, please, what is cognitive? Many are not aware of, though we hear this term kinesthetic, motor, but what are the terms exactly now?
Yeah, so in cognitive behavioral therapy, basically, whenever we are talking about any behavior, general behavior or difficult behavior, illness or disordered wala behavior, so it is because of the thoughts and emotions the person is experiencing. And those thoughts and emotions are because of the neurochemical functioning that person is having at that moment. It can be for that moment because of illness, or it can be in pattern of disorder, like inherited. And everything, this is like neurochemical and thoughts, emotions, the entire process is happening in the brain. So whenever we are talking about behavior, we have to think about the cognitive aspect of it. So how the beliefs are working, how the thought process is working, and from where it is coming. So to deal with that, we need to address those things, and simultaneously the behavior gets addressed. So if we are working on emotions and thoughts, it definitely impacts the behavior of a person. So cognitive behavioral therapy is basically on that. So work on the thought patterns.
Thought, for example, like I from school, I had only one friend. Suppose I have a class of 50 people, but I only had managed to get one friend, and I'm still in connection somehow with the friend. Then I go to college, the same thing happens. I only managed to get two friends now, two or three, and I cannot get close. I cannot open up. I cannot make friends. I feel frustrated. My God, the cluster of friends. There are so many, 12 friends. They have so well knit together, they're going to movies, so and so enjoying some light pani puris outside, but I only have one or two friends. Does this come under that cognitive part?
Yes, definitely, because it can be because of the internal traits the person has, and because of which the person was unable to make social connections. That can be the first thing. Another thing might be that there was an external scenario which impacted the social interaction, and then impacted the person's psyche. So if the thoughts and emotions got affected because of the external environment, it may get carried forward.
Suppose some anxiety at home happening, that can carry forward as cognitive.
Yes.
Suppose a subject, I am really afraid of, mugging up, writing or marks. I don't score well. I'm afraid of exams. Will that affect a cognitive behavior?
Yes, and this will be, I will say, key specific example, because either I will be having a mechanism which is not suitable for that subject, or that subject is difficult for me, or else the teacher who is teaching that subject will be difficult to deal with. So either because of this or that, a person can develop a difficulty or a trauma or a specific approach towards the subject, and then we can deal with that to overcome the fear or difficulties of that subject, whether it is innate or it is because of external environment.
Okay, so how does mindfulness help here?
Okay.
You suggest, like, if you can suggest, parents will be there. When all people in all professions, they need this. Irrespective of children, I feel so. We all need to counsel ourselves first, to know ourselves also. What can you little suggest, if you can tell?
any and all kind of relaxation techniques work a lot or help a lot with the therapy sessions or counseling sessions. So any activity based meditation is advised to people who are going through difficulties, whether it is stress, depression or anxiety, general level or clinical level, they have been advised. But we should never advise a plain blank meditation to people, because generally people say do meditation, everything will be fine. But when a person is in stress, cognitive like neurons are sparking, it becomes difficult to calm down, and then they feel more stressed that मैं तो meditation भी नहीं कर पा रहा हूँ, how I will get like cover from that. So activity based meditations help, and mindfulness is a like core of that. So in mindfulness we try to stimulate our more than one senses by doing anything healthy.
My God, see,
And there is
I
not-
learned so many new things. Not I, everyone. That when coming to you, talking to you, I came to know that active mindfulness, be in action. You're trying to say, like, I love plants, I love green, and I am little depressed. I'm not feeling happy because suppose my sister there is unwell. So I am just talking to the plant. I'm giving them waters. I'm seeing them growing with the flowers and more green. That is helping me during that time.
Yeah.
Just looking at the birds flying in the sky open, giving me help. Are you talking about this?
Yes. So touching the plants, smelling the flowers, looking at the colors, textures, feeling the breeze, anything done deliberately, actively, with complete intention to get involved gets counted in mindfulness.
Okay, but suppose like exercise. Somebody has this feel good factor. We hear the names dopamine and all these things. But in these moments, I really don't want to even exercise. I don't want to take, go with the dumbbells. I don't want to do the light exercises, also warm ups. Or if I see that even birds flying in the sky, I feel they are free and I'm caged. That was another I have heard. People have this 7 days of excitement, too excited, too happy. They don't know the reason of happiness. They're happy somehow. Sudden 2 days, total low. A total flare, the flare goes down. Why does this happen?
If we are looking at this from cognitive like clinical perspective, it can be either a cyclothymia or bipolar 1 or 2, in which there is a spike and there is a decline. Mostly if this is happening in a pattern, then it can be a mood disorder or it can be because of personality trait. So it can be either a fluctuation happening because of external factors, or it can be a mood swing happening because of internal factors.
Okay, like these things happen with, I'm hearing this too much about adults. Too much of pressure, people say, like, especially after COVID or in a stress, anxiety. Next comes our social media, our gadgets, something or the other, keeping on scrolling the phone uselessly. Yes, phone is of course useful, that I'm speaking to you, I'm connecting to somebody, it's a distance thing coming closer. But on the other hand, we say gone are the days when apple and blackberries were just fruits. They are now phones. Yeah, apple, my God, blackberry, wow. So these kinds of insertions in the mind and doesn't come out easily. We cannot be free of that addiction, I would say. We cannot be free of that addiction. Now, other than smoking or any other addiction, I think phone is the biggest one happening from a 5-year-old to a 95-year-old also.
Yeah.
So here, what would you see?
See, overuse and abuse, these are the levels. So use is definitely required, necessary.
Yes.
Like one in one of the school in parents teachers meeting, the parents suggested that why you don't shift to SMS, because this WhatsApp becomes very messy. Shift to SMS. Then one of the person from us, they said why not to shift to letters then. So we'll write letters. Why to use technology even for SMS?
Yes.
So we can't go backwards. So we have to go forward. We have to use technology. It is wonderful. It is really helpful.
Yes.
But the overuse or abuse of it is really harmful. And we have to be conscious about it. And even if we have the addictive tendency, we can deal with it. But yeah, we are more vulnerable than other people. So usually people point fingers. वो भी तो use करते हैं, उनका भी तो use है.
That's what is coming up.
Yeah.
You're telling them, why don't you also? I'm seeing a child is talking to the mother. You also using the phone. Why do you tell me then? So now, yes, one part is good. The mother becomes aware. The next part is the mother really needs it, but then there is something that she can't manage and she doesn't know how to at that time handle the child. So these are opposite spaces I see. That the mother has to use, father is using, grandfather is using, then why will a child not use here? As you said, yes, we can't go backwards, but of course writing a letter always helps. It has Now I will talk to you about a bit of writing, journaling. Do you tell children, do you tell your patients to journal their feelings, write their feelings?
I'm much more liberal in that because I'm always a part of like that debate since my student age,
Okay.
that why to give a same kind of activity to each and everyone.
Each and everyone.
So हर
Okay.
like हर भैंस को एक ही लाठी से नहीं हम ये
तब
चला
डिफरेंस
सकते हैं.
के साथ आप डिफरेंट डील करते हो,
Yes, so
जिसको
if
क्या जरूरत है.
yes,
फॉर एग्जांपल कैन यू टेल?
so if someone is in art, so they can draw or they can sketch or they can
Colors.
color code it. If someone is into numbers, so they can like numbers से वो put up कर सकते हैं कि how they are feeling और ये quantify कर सकते हैं. If someone is into writing, they can write. If someone is not into writing like paragraphs and all, they can write a poem. So they can
Fine.
express in any form they are
Any way,
comfortable in.
any
So
way.
they can journal, they can express, they can release their emotions in any form. So it's up to them. Otherwise, if we stick to that, so it's same as the homework thing. How many students in the class enjoy the homework? There are very particular number of students. So those are the people if they come as a patient, so they will enjoy the homework in written form.
Yeah.
Other students may not. The students who are into art or music or maths, they will try to
So
do
everything's a therapy now, color therapy, music therapy. Where had we learnt of this? Music therapy, dance therapy, even laughter is a great therapy.
Yeah.
So all these things that we merge together is also mindfulness.
Yeah.
And of course, we are becoming little, solitary, I think. Solitary, I would say. Loneliness somewhere is, cribbing inside us.
Yeah.
They are making us cranky somewhere. Children, adults cry in the secrecy, sometimes open also. Children cry out loudly. ये तो difference है. But हाँ, अगर कोई रोने का ये habit आ जाए, आदत, every little thing this child cries.
Yeah.
So in that case, children who keep on crying until the things are met out or they can't express, they only cry. Or they get very emotional, very small things, very easy things, they get emotional. I have seen children crying, my God, they could not get 25 on 25 on some subject, crying hysterically. What would you say for that?
So we were talking about crying.
Crying, yeah.
I will try to relate it here with pain. So actually the pain is necessary for body. So fever, vomiting, nausea and pain, these are required things. But the level, as you said, कि कितना रोए, कितना ये करे.
Yes, yes.
So pain is necessary. But कब तक हो? 2 महीने हो गए, 2 हफ्ते हो गए, बार बार हो रहा है. Then we need to address the origin. So if person is crying repeatedly in unhealthy way, because crying is healthy, we can do as much as time as we want. But if it is happening in healthy way or it is getting closure, so if after crying person is feeling happy, relaxed and able to continue the life in a better way, then it's good. But if it's not stopping and it's getting connected or it is stuck in loop, then every time the child is crying and not ending that venting in a healthy way, then we address those emotions. Then we address the origin of it कि कहाँ से आ रहा है, क्या चीज़ है जिस वजह से वो stuck है वहाँ पे. So वो stuck चीज़ को अगर steer up करे healthily, तो धीरे धीरे वो निकल जाता है and then the crying stops. But otherwise it's a healthy thing.
Now when it comes to treating mental issues, how do you tell them about psychotherapy and medication?
Okay.
It comes to it about psychotherapy and medication. What do you suggest? This is one point. Also, parents have a big role, of course. Family members, mainly parents, when they are bringing their child to you, they are giving their trust to you. And how do you deal with the parents also? Because they also become one kind of, your patient. They become a person who you have to counsel them also, I feel. How do you guide the parents here?
We will divide these things into 2 sections, primary and secondary. The biological functioning of the patient, the personality organization of the patient, and the family environment or approach of family. This comes in primary thing.
Okay.
If these primary things are well maintained or in a better way, then it becomes very easy for secondary thing to work. So counseling, psychotherapy and medicines come in secondary section.
Okay.
So if the primary is really well, then it becomes very easy. Less sessions, less medicines, person gets
Primary in
better.
the sense of telling the parents' approach and all these things.
Yes, and biological and psychological
growth
basic,
there.
Basic of that person. Yeah, so that base is good, then it becomes very easy.
Okay.
If that is not good, then it becomes really, really difficult.
You again have to do a task.
Yeah, usually people ask us, कितना time लगेगा depression से ठीक होने में? So it can take 4 weeks to 4 months or 4 years. Depends on internal and external environment. Because our treatment approach is same. Like the intensity we adjust, but the approach is same. If the primary things are like taken care of, then it becomes very easy for us. Even
so
chronic condition.
Medication आप suggest करते हैं medicines?
Medications only they are only given by practice the registered clinicians who
Okay.
are either MBBS or
Okay.
further degree. So in our case, diploma in psychiatric medicine, MD in psychiatry, or DNB in psychiatry. Only those people can, those three people are called as psychiatrists.
Okay.
They can only give medicines. No other professional
No
is,
other profession
yeah,
is allowed. तो यहाँ पे वो जरूरत होती नहीं है.
Hmm.
So they have how many counselings, as you said, how many seatings? Like it will take 4 weeks and all. ऐसा है तो आपको क्या पहला दिन या सेकंड डे तक लगता है टाइम समझने में, या फिर यू कैन टेल?
मोस्टली फर्स्ट सेशन में पता चल जाता है.
Okay.
कभी कभी आगे चल के पता चलता है,
Hmm.
बट ऑलवेज अगर क्लिनिकल की बात करें तो ऑलवेज इन कॉम्बिनेशन विथ मेडिसिन इट हेल्प्स अ लॉट, द प्राइमरी थिंग्स एंड सेकेंडरी दोनों. सो मेडिसिन के साथ ज़्यादा बेटर होता है. आई विल से लेस देन 20% ऑफ पॉपुलेशन बिकॉज ऑफ देयर प्राइमरी थिंग्स आर इन बेटर कंडीशन. विदाउट मेडिसिन भी हो जाते हैं. रिकमेंड भी नहीं करना पड़ता है. दे मे टेक लेस और मोर सेशंस बट विदाउट मेडिसिन मैनेज हो जाते हैं. देयर बायोलॉजिकल फंक्शनिंग इज सेटल. सो खाना पीना सोना अच्छा है, पर्सनैलिटी ऑर्गेनाइजेशन काफी ऑप्टिमिस्टिक है, बैलेंस्ड है, एंड थॉट प्रोसेस इमोशंस बैलेंस्ड है, एंड फैमिली एनवायरनमेंट और वर्क प्लेस एनवायरनमेंट इज गुड. सो इवन इन क्रोनिक कंडीशन पेशेंट रिकवर वेरी क्विकली एंड सरप्राइजिंगली दूसरे तीसरे सेशन में ठीक हो जाते हैं.
इसके साथ आप जैसे डॉक्टर्स अगर है, हेल्पिंग हैंड है, तो फिर तो होना ही चाहिए. इट इज एक्सपेक्टेड दैट दे विल डू गुड. The pandemic has really hit us hard. Children are also affected. That has started school with mobiles.
Yeah.
And it was also a helpless situation. इसमें ना ही स्कूल, ना ही गवर्नमेंट, ना ही कोई इंस्टीट्यूशन का कोई दोष है. कोई कुछ नहीं कर पाया. And they had given but their best. They tried to communicate in the best way possible. पर मोबाइल सबके हाथ में आ गए.
About the use of mobile and all, शुरू किया because it was needed. But I think बंद करना भूल गए सब लोग. कि नहीं पता है.
थोड़ा सा सजेस्ट करिए मेरे व्यूअर्स को कि थोड़ा सा आप लोग संभल जाओ, और ताकि मोबाइल यूज भी करो आपके बेनिफिट के लिए ही करो.
Yes.
ना भी करो तो भी आप ही का बेनिफिट है, और किसी को कोई लॉस वाला तो होने वाला है नहीं.
Yes.
It's only you. So please tell them, please guide them a bit.
So थोड़ा स्ट्रक्चर करना जरूरी है, खुद के लिए भी और बच्चों के लिए भी. ये बहुत अनहेल्दी अप्रोच होगा कि हमारा काम है, हम बड़े हैं, तुम छोटे हो तो तुम मत यूज करो. बेटर है कि एक मॉडल बिहेवियर उनके सामने प्रेजेंट करे. सो टू ब्रिंग इट इन स्ट्रक्चर, कितना यूज करना है, कितना नहीं, कितना हेल्दी है, कितना नहीं. और उनके सामने अगर हम वैसे ही एक्सपोज करते रहेंगे तो दे विल डेफिनेटली लर्न दैट. क्योंकि नॉन वर्बली बच्चे ज्यादा सीखते हैं, विद एक्सपीरियंस ज्यादा सीखते हैं. सो बेटर है कि उनको ऐसा एक्सपोजर दे.
Thanks a lot, doctor. Now, last question, last but not the least. I would say, as you said the word modeling, do you really advise people to model someone, a celebrity, a popular, successful person, a writer, a film star, a cricketer, or any person that they like, musician, modeling someone or any inspiration, the society, any person there, their teacher, favorite, their grandparents, anyone. आप क्या बोलते हैं बच्चा इसको आंख बंद के बस मॉडलिंग करिए? You think about that, and is there any frame like this that you use?
I will say in anything and everything, like any specific thing is never perfect. So it's always a combination of any particular diet, any particular food. कि कोई ऐसा super food नहीं होता, super
Nothing
diet
is a
नहीं
must,
होता.
you say. Not one is a must. Yeah.
Even exercise and all. तो वैसे ही किसी एक particular figure को real या जो भी fantasize करने वाले हैं, तो fantasy world या real में किसी एक figure को, एक approach को fantasy ये करना, idealize करना सही नहीं है, model करना. I will recommend कि कोई specific अच्छा behavior, अच्छा trait, अच्छा strategy.
उनसे अच्छा लीजिए.
हाँ. तो ऐसे मल्टीपल चीजों से, मल्टीपल जगह से लो तो और स्ट्रेंथन होगा. एक ही फॉलो करोगे तो वो क्लोन या कॉपी हो जाएगा, एंड वो
फिर बोरिंग हो जाएगी, एंड देन यू कैन नॉट रिलेट योरसेल्फ,
एंड फ्लॉज भी साथ में ही आ जाते हैं उससे. तो बेटर है कि कॉम्बिनेशन ऑफ अप्रोच, कि जो हमें पसंद है, जो ना भी पसंद है, उनसे भी अच्छी अच्छी चीजें सीखनी है.
नाउ यू टेल माय व्यूअर्स दैट इफ दे वांट टू कम टू यू, विजिट यू, क्या क्या कंडीशन, क्या कुछ सिनेरियो में उनको लगता है कि नहीं मुझे अभी लेके जाना चाहिए, मेरे बच्चे को अप्रोच करनी चाहिए?
Okay, I will say mental health is as equal as physical health. तो जैसे सर्दी बुखार जुकाम आता है या थोड़ा वीकनेस महसूस होता है, तो हम कंफर्म करने के लिए या क्लैरिफाई करने के लिए भी डॉक्टर के पास चले जाते हैं कि क्या सच में कुछ है, या हम थोड़ा CBC वगैरह करवा लेते हैं. तो वैसे ही यहाँ पे हमारे पास ऐसे बेसिक स्क्रीनिंग, बेसिक डाउट्स लेके भी आ सकते हो. रादर आई विल एनकरेज कि वही लेके आ जाओ, ताकि वो बढ़े ना और फिर हमारी ज्यादा जरूरत ना पड़े. तो बेसिक स्क्रीनिंग के लिए आ सकते हो. फिर काफी बार वो लोग कहते कितनी बार जाए, तो फिजिकल हेल्थ के लिए हम कितनी बार डॉक्टर के पास जाते हैं? कभी कभी 2-4 महीने में एक बार, कभी कभी 5-6 सालों में एक बार, कभी कभी 10 सालों में एक बार. सो इट वेरीज पर्सन टू पर्सन. सो देयर आर सम पीपल जो बचपन से कभी डॉक्टर के पास गए ही नहीं है बड़े होने के बाद, और देयर आर सम पीपल जिनका साल में 1-2 बार तो हो ही जाता है. तो वैसे मेंटल हेल्थ का भी है कि छोटे मोटे प्रॉब्लम हो तो ही आ सकते हो, ताकि बड़े प्रॉब्लम्स होने तक या वो बड़े होने तक आपको सफर ना करना पड़े. एंड अगर आप नहीं आ पाते हो तो यू कैन टेक ऑनलाइन सेशंस। मैं रिकमेंड करूंगा कि अगर इंटेंसिटी कम हो और इंसाइट अच्छा हो तो ऑनलाइन सेशंस भी वर्क कर जाते हैं, बट अगर इंटेंसिटी ज़्यादा हो और इंसाइट थोड़ा कम हो तो बेटर टू गो फॉर ऑफलाइन
Offline, of course. Online तो है ही, possibility
Yes.
तो है ही, but offline is the best always.
Yeah.
So thank you so much, doctor, for your questions
Welcome.
and answers, and for giving me also the idea, the knowledge about what this is all about. And parents and children and my viewers, I will surely give the address of Dr. Swapnil Bhopi in my description box. If you would like to meet him, if you would just like to have a counseling session, take some kind of advice, don't hesitate. Don't think it's something bad. People will come to know about some secret, there's something going wrong. No, it's you. Again, I'm telling you, you should be the prior importance to yourself. This is the place if you need, and don't hesitate to come again. And today we are signing out. I hope you like this. Bye bye.